So much pain, I wouldn't be able to leave my bed or the washroom for the first 2 days of my period. I never understood why my friends would never get as sick as me. This was the first time I felt isolated. Every month I would miss at least 2 days of school. I'd miss out on birthdays, holidays, special occasions. My mom used to console me and tell me that she used to have the same thing when she was young. When I would go to my doctor, she would tell me that this is normal. Every woman goes through this. It's nothing a little Advil couldn't help. My name is Katelinda Luciani and I have endometriosis. Well, actually I have endometriosis, adenomyosis, chronic pelvic pain, chronic back pain, vulvodynia, pelvic floor dysfunction, and I also suffer from depression and anxiety. It wasn't until I first started becoming sexually active that I also noticed something else seemed off. Sex wasn't fun. It sucked. It was painful. I would be nauseous afterwards, horrible back pain, cramping. At this point I was living in Vancouver and I went to a doctor out there. His initial reaction was, oh, it's cervical cancer. And after that was ruled out, he told me about endometriosis. That was the first time I ever heard of that word. But I didn't think it was that big of a deal because he insisted it wasn't and that the Mirena IUD would be the answer to my prayers. Well, it wasn't. Insertion was horribly painful and I cramped and bled for 2 years straight. I have never felt the same since. Finally, I was told that my body was rejecting it and I had to have emergency removal. I was told to just stay off of any type of birth control because I had been on it for so long, from the age of 14, and I was 25 at this point. A few months later, I started experiencing multiple ruptured cysts resulting in over 3 hospital stays in just under 4 months. I was told this time that surgery was the answer. I was trying to pursue my dreams in Vancouver where the surgery was performed. The outcome was that he didn't find anything. According to him, my uterus was beautiful looking on the inside. There was nothing wrong. The pain just got worse and worse. I was in severe pain, and still there were no answers. I was forced to give up my dreams in Vancouver and to move home, back to my parents' house in Ontario, where I waited patiently for my turn to get into Wasser Pain Clinic. Waiting patiently. My endo warriors know exactly what that feels like. In the meantime, my gyno referred me to a pelvic physiotherapist who I would see weekly for my vaginal spasms, as well as internal manipulation to aid in my pelvic floor dysfunction. I was excited knowing that I would have some of the best doctors working on my case, finally some answers, some help. It was many months before I would finally get in to see them, and I would try anything they suggested to end my pain. Blind nerve block injections were suggested as a treatment to numb my pelvic pain. 2 to 4 needles were inserted into my pelvis on 2 different occasions. This was another letdown. I now suffer from chronic pain in that area and hip locking as a result of it. Another specialist suggested hormonal therapy, Vizan. The side effects from this resulted in a brief breast cancer scare, which did wonders for my anxiety. I now have permanent, agonizing cysts in my breasts and have an even deeper hatred for my own body. It was right around this time that I had hit an all-time low. I was completely discouraged and hesitant to try any other kind of hormonal treatment that was being offered to me for fear of the side effects of my body. I was tired of being a guinea pig. I felt so alone. I was so tired of hearing that it was all in my head, that I just needed to take some antidepressants. It was right around this time last year that I reached out and I found this amazing support group. And after having met other people who had such similar stories to mine, I started seeing things in a different light. Maybe I wasn't crazy. It was so comforting to know that I was not alone in my pain. I started hearing from more and more people who said it was so common to have a number of surgeries before endo was even found, that sometimes the surgeons aren't necessarily trained to spot endo in all of its forms. I went to the endo symposium last year and educated myself even more. I left feeling empowered. There was something I could do. With the encouragement and financial support of my parents, I finally sent all my health records to a world-renowned endo specialist in Atlanta. For 2 years, I was bouncing back and forth from doctor to doctor, who all kept referring to that original surgery, saying that it couldn't possibly be endo. Well, a week after sending my records in, this endo specialist called me, and after reviewing everything, he confirmed that I most likely had endo, and that it was possible that he could improve my quality of life by 85%. So I took the trip out to Atlanta. During the surgery, he found endometriosis in my cul-de-sac, on my right lower ligaments, on my appendix, on my bowel stretching across to the right side of my rib cage, as well as in the muscle lining of my uterus. He removed all my lesions as well as my appendix and performed a pre-sacral neurectomy, which involves snipping the main nerve to your uterus bladder, and bowel area. This is said to work for 75% of patients who no longer feel pain in that area. I, unfortunately, was not one of those lucky 75% of patients that this works for. I was told to give my recovery at least 6 months, and I was devastated when there was barely any improvement. This was so bittersweet. I finally had an answer, but no pain relief. After constantly getting knocked down by this disease, I am standing up yet again, right here with all of you today. I am still in pain. I still fight to get through the days, today included. I want my voice to be heard. I am not crazy. The symptoms are not in my head, they are actually in my uterus. In the spirit of the wall of wishes right over there, I'd like to share my 3 wishes with you all. I wish for more pain-free days that I can spend laughing and making memories with my loving boyfriend, with my incredibly supportive family that I am blessed to have, and that includes my endo family, and with my friends who, thanks to this disease, I don't get to see as often anymore. My second wish is for more funding for endometriosis research here in Canada. And last but definitely not least, I wish for the next generations to be educated about endometriosis in health classes at school. Knowledge is power, and together our voices will be heard. Thank you.